everybody walks in my office and it's like, I think I have fibroids. And I'm like, it could not be fibroids.
I know I have fibroids.
I know I have fibroids. My bleeding is irregular. It's so easy for us as women a lot of times to kind of make the scapegoat what we most commonly hear. Everybody walks in my office and it's like, I think I have fibroids. And I'm like, it could not be fibroids.
I know I have fibroids.
I know I have fibroids. My bleeding is irregular. I know I have, and I'm like, okay, so do you grow any hair in places that you don't want to, that you think is not feminine areas, like on your chin or your chest? And they're like, oh, actually I do. And sometimes as doctors, we can look at patients and even see a very stereotypical look to them that makes us
acne
questions, right? Exactly.
We talked about what a fibroid is, another type of tumor, but it is associated with the uterus more commonly because that's the tissue it typically arises from. Polyps are probably one of the most common things second that I see in infertility, second to fibroids. So polyps are benign growths of the lining of the uterus. So whereas fibroids are from a cell of the muscle layer, polyps are from the lining, which is the endometrial layer of the uterus. So it's glandular tissue. Most commonly, they are benign growths, so they're not cancerous, but because they can change the blood supply to the uterus, and they potentially may secrete toxins that will decrease implantation of an embryo, they do impact fertility. They also cause some of the similar symptoms to fibroids as irregular bleeding and heavy bleeding because they have blood supplies to them that can be easily disrupted, causing irregular bleeding. A cyst is generally a fluid-filled structure in a part of the body. Typically in gynecology, a cyst is more associated with the ovary, so an ovarian cyst, which can be physiologic, meaning it's a normal process. When we ovulate, we produce a cyst, and then that cyst ruptures and an egg is released. There are other forms of cysts that are benign, which means they don't cause any issues, or malignant, meaning that they need surgical intervention and potentially chemotherapy. When we talk about PCOS or polycystic ovary syndrome, that is a syndrome that basically means your male type hormones, or otherwise known as androgens, can be elevated. We all have male hormones and we all have female hormones. And so sometimes when I say that, people get a little bit taken aback because it's like, I'm not a male, why do I have male hormones? Well, we have them, they're just in a lower, they're produced in a lower quantity than in our male counterparts. But when that kind of creeps up, then our body reacts by not releasing eggs. And if you're not releasing eggs, you're not ovulating and you're not getting a critical hormone, progesterone, that will help stop fibroids from growing, for one, and help you sustain a pregnancy, for two, or trigger menses when that hormone is gone if you're not pregnant in that cycle.
It can also present as endometriosis as well, right? And adenomyosis. I know when I was pregnant, I actually had polyps in my cervix that had caused bleeding, and we didn't know. It was a scary moment because I was bleeding, and I think I was about 5 months at that time. And they found that the bleeding was actually originating from a polyp, and it wasn't the baby. Baby was perfectly fine.
That can be really scary.
Yeah, that can be very scary. And sometimes those polyps can actually just be removed in a GYN visit, right? Because they're accessible right there in your cervix.
Adenomyosis should be added to that list because that is one that I think is
and endometriosis.
And endometriosis. Adenomyosis is endometriosis of the uterus.
Right.
Adenomyosis, it is a cousin, I call it, a sister friend of endometriosis.
Cousin you don't invite to dinner.
She's not invited over. It's underdiagnosed, it's under research, it's under not well understood, and unfortunately, therefore, leaves a lot of women feeling somewhat hopeless in their journey, especially when it comes to their fertility journey, if it is standing in the way. Mm-hmm. Adenomyosis, in its simplest term, is when the lining or the glands of the uterus, actually the glands of the cavity of the uterus or the endometrium, actually digs into the muscle and implants itself in the muscular layer. And it can cause heavy bleeding and painful cycles, or just pain, period. We started to come into factors that adenomyosis contributes to. And unfortunately, it can't be cut out. It's not something that we can remove because it's not discrete. It's not a tumor like a fibroid. It's not endometriosis in its classical terms in the lining of the pelvis, like peritoneum, that, you know, doctors like myself will actually cut out and remove. With adenomyosis, it's in the muscle of the uterus. And so then you have to look at either medical interventions or, you know, find ways to live with the symptom, to adjust the symptoms of it, like lifestyle adjustments that Coach talked about.
Yeah, that's where we've seen the results. Honestly.
That's where you see the results.
Yeah.
So again, listening to your body and listening to your symptoms and going to the doctor so they can help you navigate what might actually be going on.
And for some women, there's a combination of all of them or two of them, or, you know, in one person, because they are sometimes hormonally derived. So if your estrogen level is driving fibroids, it might also drive polyp development, and it could be originating from an ovarian cyst. So all of it, you know, it's not mutually exclusive.